everyone, and welcome back to my weekly Sunday 9 p.m. live video. Okay, so we have been talking a lot about COVID-19 over the last few weeks, and today I'm going to complete the last session of this series of topics regarding COVID-19. So I first started talking about a video that actually went viral regarding the face mask as well as the pulse oximeter, and I'm glad that I do see a lot of my patients nowadays who come to my clinic and they have actually bought the mask that can protect them better. Okay, and then the second round I talk about vaccination, and I'm very glad that government has already now given an option for women to actually pick to inform government that they are pregnant or breastfeeding, and that would have caused a lot of less problems that could have arisen. But a lot of people think that by ticking that informing government through the MySejahtera app that they are pregnant will give them priority to be vaccinated. Actually no, because we are still running phase 2, and phase 2 is only for high risk pregnancy. So it is not for every pregnant woman, but women who are pregnant with multiple medical illness. Like if you are pregnant with heart disease, you are pregnant with whatever disease, then at least government will call you now. But until we open phase 3, only in phase 3 the regular pregnant women without any risk factor will be called. Then why is it that MySejahtera need to have that thing? Because we do not want incidences like in the past. Because in the past, what happened? Like frontliners, we have been getting vaccines since March this year, and there are many frontliners who are actually pregnant. So what happened? Like some of my staff who are pregnant or breastfeeding, when they were called to go for that vaccination, when you get the information from government to go for vaccination, you do not actually know whether you are getting Pfizer, Sinovac or AstraZeneca. So when they got the information, they went to the vaccine center only to realize that they are getting Sinovac. And then because breastfeeding and also pregnancy, they do not give Sinovac. So these two staff of mine were asked to go back and wait for their turn again. So you see, that is really a wasted opportunity, because that if they knew that they were pregnant, they wouldn't have called them to go to a center that is going to give Sinovac, right? So now, at least if you have informed government that you are breastfeeding or you are pregnant, then at least now government will not have to call you, and then when you come and then they will found out that you are not suitable for that vaccine, and then that particular slot you have so much trouble to get another person to replace your slot. So this will actually be a better off option, and I have to thank to some of the people out there who actually requested government to include this in the MySejahtera app. So for all of you who are pregnant and breastfeeding, so remember to update your MySejahtera app, okay? And for all of you who are pregnant, because I know a lot of pregnant and breastfeeding mothers who have actually not registered with MySejahtera because they're so worried that they will be called and then they are not suitable. So now you do not need to worry anymore. You register with MySejahtera and inform MySejahtera that you are pregnant or breastfeeding, so that government knows the right vaccine to give you, and the government also know the exact time to call you. So they don't call you in early pregnancy, they don't call you in late pregnancy, they will call you at the right time that you're supposed to get your vaccination. So for all of you pregnant women out there who have not been vaccinated, please do so, okay? And then last week I was talking about vitamin C, as I know many people are going crazy over vitamin C as the number of cases go up. So if you have missed that, please watch my video, yeah? So to watch all my previous videos, you can either browse through Facebook. If you don't see it, please go to my YouTube channel. My YouTube channel is in the link above in this post. Please go to my YouTube channel, subscribe to my YouTube channel, and turn on the notification button so that you'll be notified whenever I have new videos, okay? So today what are we going to talk about? We're going to talk about happy hypoxics. I think I mentioned a bit about happy hypoxics in my first first video on COVID, which is 3 weeks ago. Okay, but I don't think I talk much about happy hypoxic. Let's tell you a bit more about happy hypoxic. What are the stories that I hear? Okay, that we know, that we have seen. Happy hypoxic means what? Hypoxic means a shortage of oxygen. Hypoxic means your oxygen in your body already deprived. Your oxygen in your body already down. You are no longer getting enough oxygen for your body. That is what we call hypoxia. So hypoxics are people with hypoxia. So people with shortage or lack of oxygen in their body, that's what we call them hypoxics. So why I call it happy hypoxic? Why is this term? In fact, this term, we seldom hear it until recently. In the past, we seldom hear it because most people, when they are hypoxic, they are usually very sick. And when they are very sick, they are usually tired, they are in hospital, they are dead and dying. They are not walking around, working, doing everything like normal. So this unique group of people where we call happy hypoxic is people already lack of oxygen, but still they are very happy in the sense that they look okay. They look okay. They look like someone who can come and see you, can go to work, can go shopping, can go everywhere, and yet they are already hypoxic. And that is the danger with COVID-19, because these things, some of the case scenario I want to show you is, for example, I know this particular doctor very, very early on in the pandemic. This particular doctor, he was still operating today. He's operating today. Then after his surgery, he was informed that his wife is positive with COVID. So naturally, when he was informed that his wife is positive with COVID, he went for a COVID test. And then when he went for his COVID test, he was tested positive. He knew the next morning. So the next morning, he knew he was positive. So he admitted himself into the hospital. And guess what? The next day, he was already in ICU. You see, it was so fast. And 2 days before he was in ICU, he could still do surgery for people. He appears to be very healthy. But actually, he's not healthy. He did complain something. He did just say, I feel a bit cold. That's all. That's all. How many of us sometimes feel a bit cold, especially in an operating room that is 16 degree, 18 degree. Operating rooms are very cold. If you remember, any of you who have been on a surgery, you will know whenever you enter the operating room, it's so cold. So of course he's cold. His only complaint was he's cold. But because he knew that his wife is positive, so he tested, and 2 days later he's in ICU. So you see, it is so fast. You are so well, you think you're well, but you're not necessarily well. That is the thing about COVID. Another case scenario that I would like to quote is someone who actually, not long ago, she actually had some flu and sore throat. So she's feeling not well, but instead of going to see a doctor, she actually went to see a Chinese physician. She went to see a Chinese physician complaining of cough and flu and sore throat. So the Chinese physician examined her and said, okay, I give you some medication, you go back and eat. And guess what? The next day, she was found dead at home. Found dead. So this is the thing, we're worried. Because I'm quite sure when the Chinese physician saw her, he didn't think that she is that sick. But she was actually very sick. The younger you are, the more likely to have all these things, especially like very early in the pandemic. I'm not sure whether you hear a lot of news back in Wuhan and China, where there are little kids that are very well, they have no problem, and then during the Chinese New Year, they went back to their grandparents' house and they bring the virus and infected everyone in the family. And then last of all, they decided to do an x-ray for the child, and they saw that the child's lungs was actually gone. Gone. Very bad. But the child is well. So in these type of cases, if you were to check the child is not well, but the child appears well, looks well, but not well. When you actually scan the lungs, it's bad. Nobody knew he had COVID because he looks well. So when he went back for Chinese New Year last year, he brought back the virus to everyone into the family, including the grandparents. So these are things that have happened. So, and one of the worrying thing is, I'm sure when you look at the census every year, every day that we get from our minister, from our DG, we have so many deaths nowadays. We have so many deaths. And you know some of these deaths are brought in dead. What do you call brought in dead? You will know because you read in the report is written this case, what age, and it will be written jenazah dibawa ke hospital. It's not the patient died in the hospital, but the body was brought to the hospital. So the patient actually died at home. So this is worrying because we now know that COVID can make you feel you're so well and yet you can die tomorrow. So it's quite worrying. So one of the things is during the period when you think you are well, you are not actually well actually. But because nobody knows you are not well, so that is why you can actually die the next day. Another worrying thing is something that happened to someone I know as well. That is the father-in-law. The father-in-law is quite old and he's been tested, he has been coughing for many days. Then they went to GP. GP gave some medicine, never tested him for COVID. But when this person, because she knows me, in fact she's my staff, so my staff say my father-in-law doesn't look quite right, he looks quite sick. So they decided to ask us whether we should do a COVID test. So we did a COVID test on the father-in-law and it was tested positive. So when we knew the father-in-law was tested positive, of course we asked the father-in-law to go to government hospital, right? So he immediately went to, because he's quite sick, so he went to the emergency department. But the emergency department sent him home. He said, you go home and wait. Okay, so as usual in COVID, they usually ask you to go back and wait. You just report to government and you go back and wait. And then what happened is that, you see, when you have someone with COVID at home, what is going to happen? You're going to ask the person, you stay in one room, you go inside there, you don't come out, right? That's what we ask everybody to do. Isolate. Everybody needs to stay far away from everybody, isn't it? So you will ask that person to stay in a room and then don't come out, and then the rest of you also all stay in your own room, don't come out, and don't mix with each other. But do you know that that is a very dangerous thing to do? Because your father-in-law or your grandfather or your grandmother that is in the room alone may be having hypoxia which you do not know, and suddenly deteriorate and die and you don't know. Because in this case, he didn't die, but the next morning when they wanted to bring food for him, they went to the room, knocked at the door, no response. So went into the room, he already unconscious on the floor. Unconscious on the floor. Since when? Don't know. Thank goodness he's not dead. Thank goodness he's not dead. So they brought him to the hospital, admitted to hospital, immediately to ICU. You see, the night before, 2 nights before, he was seen at the emergency department and they don't think he was in any bad shape. And 2 nights later, he's on the floor in ICU straight. That is how worrying it is when you have COVID and you're at home. So now, what is the problem? Why is COVID like that? Because COVID is not like other illness. Let's say if I get influenza, I don't behave like COVID. In influenza, what happens? I have cough, I have flu, I have fever, I have sore throat. Then over the next few days, if my immune is good, over the next few days, I improve. I get well. If I don't improve, the infection gets worse. The influenza virus goes into my lungs. I actually feel worse. I feel more sick. I cough more. I feel more and more worse. My symptoms become worse. I get more tired, more headache, more body ache, higher fever, and I have worse coughing, getting worse, everything getting worse. I know I'm not getting well. So over time, then my oxygen saturation will come down. I will slowly become hypoxia. So in a normal infection of the lung, normal viral infection that we get in the past, we actually get worse slowly over time. And because we get worse slowly over time, we will definitely go and see doctor again, right? Today I am sick. Next 3 days I'm still so sick despite all the medication I take. I'm feeling worse. What would I do? I will go and see the doctor, right? And then the doctor will assess me and say, oh my God, now your viral infection has gone to the lungs. It's quite bad. You need to be hospitalized, right? That is what happened in normal viral infection. But in COVID-19, it's different. It's very special. Because what happened in many COVID is like this. They get the infection and they actually get better. They actually feel they get better. The viral infection is already improving. That means my cough is improving, my fever is coming down, everything is getting better. And of all the sudden, another 1-2 days later, I just suddenly become bad. Because in COVID infection, it is not an infection that slowly go down into our lungs. So the rest, like other viruses and bacteria that cause a lung problem, is actually initially they infect our nose, our throat, and then slowly it goes down into our lung. But in COVID, it's not that. So the first round of infection, which lasts for, let's say, 3 to 5 days, it only lasts for around 5 days, 6 days, and you're all over. Like a couple of days back, I didn't ask back, but my ex-classmate texted me. He said my 82-year-old grandmother is still at home, but she's currently feeling better. She told me she's feeling better. But because she saw my video on the pulse oximeter, so they actually bought a pulse oximeter from the pharmacy, but not the pulse oximeter. Her pulse oximeter 2 days ago was 98%, but today is 95%. It's coming down. It's not better, but she's feeling better. That's the danger of COVID-19. You feel better, but your oxygen saturation is not necessarily better. So I was also a bit worried, but I didn't ask her back after that. But this is what happened with typical COVID-19. Your infection improves. Your infection improves, so you feel better. Your cough come down, your fever come down. Everything seems to be getting better. But next 1-2 days, suddenly, the whole lungs is gone. Because in COVID, it is not about the infection going into the lungs. It's not about that. We call it a cytokine storm. A cytokine storm, it is like those not so good chemicals in our body that will destroy our body. There is a storm. These very, very highly toxic chemicals suddenly release in our body and go target the lungs and destroy our lungs just suddenly. We call it a cytokine storm. It is a storm. Why do you think we call it a storm? Because a storm comes suddenly. A storm cannot always be predicted, like weather forecast. We always can forecast tomorrow's storm, but sometimes the tomorrow no storm. Or the weather forecast say tomorrow is bright sunshine and then suddenly tomorrow got storm. So it's the same. We do not know which COVID-19 patient will develop a storm. So we know you have a risk, but we do not know who, and we do not know when. It's not too late. It's not usually 1-2 weeks after. No, it's maybe day 5, day 6, or day 8, day 9. Somewhere around between the 5th to 10th day of your viral infection. It will just come suddenly because it's a storm. And all of a sudden, it will attack your lung and destroy your lung. And after that, because of the places in your lungs that are destroyed, your body also forms blood clot. So you have blood clots in the lungs because apparently when you do an autopsy on a COVID-19 patient who dies, you don't actually see infection of the lung. What you see is blood clots everywhere in the lung. So it behaves in a very funny way. We do not know exactly why, But one of the things we can suspect is because the body have not seen COVID-19 virus before, there is no program in the body to tell the body how to react to COVID-19 because it is a very, very new virus. There's nothing in our body to teach us how to react and how to fight this infection. We have never had COVID before. We don't even have, we call a genetic memory because our ancestors also never got COVID before. So our body do not know what to do to attack this virus. So he just suddenly out of nowhere produced so much toxic substance to kill our own lungs. The way I like to describe is like, you know, sometimes we watch movie, an alien comes down into this world, we shoot the alien, never die. We use bomb, the alien never die. What at the end we will be used? We use nuclear bomb. You know, it's always in the movie, they just shoot down a nuclear bomb. Then that's how they solve the problem. That's exactly how our body is trying to solve the problem. First, they cannot get rid of it. They don't know how to get rid of it. They don't think the normal immune is working on this virus. They just suddenly out of nowhere produce so much toxins to the lung and gone. So that is why it causes this storm, and this storm comes so suddenly, and apparently even if you are well, it can suddenly kill you. So that is what happens with happy hypoxia. So we do not want that. Is there a way to prevent? We know a lot of scenarios how the happy hypoxias come. Number one is either they went to see a GP, but no COVID test done, so nobody knew he's having COVID, and he went back, and then nothing happened, then they look relatively well, and then 2 days later is dead at home. So you ask me, like today I had this lady who came to see me for some other reason, and then she's coughing. I noticed she's coughing in my room. I told her, have you checked your COVID? And she said, no. How long have you been coughing? 2 days with sore throat. I said, you better do now. I did. Luckily, she's negative. Anyone, even if you have mild cough, mild flu, mild sore throat, mild fever, please check your COVID test. That's the first thing you must do. Don't care what your GP tell you, what your Chinese sensei tell you, do your COVID test. Because now the virus is everywhere. If you have loss of taste, loss of smell, oh, that one is almost guaranteed COVID already. Better do your COVID test. Because if you don't do your COVID test, then you won't be checking for your oxygen level. And that is high risk of dying suddenly out of nowhere. So that's the first thing. First scenario. Second scenario are people with cough and flu and think it's okay, just take a bit of Panadol and see what happens. Don't do that. With so many cases out there, don't do that. From our statistics and the number of positive cases and the percentage of positive results, we know there's still a lot of COVID patients that are not diagnosed out there. So if you don't feel well, please do your COVID test. Go anywhere, clinic, hospital, do a COVID test. And for those of you already know you're COVID positive, you need to monitor your oxygen saturation. And that is what I talked in the video 3 weeks ago regarding a pulse oximeter. I asked many of you to buy one. You can get it anywhere. Walk into any pharmacy, you can buy one. Just say, I want a pulse oximeter. And if not, you can buy it from Shopee, Lazada. Just don't get something too cheap. Get something that is maybe around 100, 200 ringgit. And what you do when you have this is it's actually very easy to use, and I think anyone who buys a pulse oximeter knows how to use it. Whether or not you have COVID, I think it is also sometimes quite nice to have one at home, just monitor and see what's the percentage. So most people, you must first of all know what is your normal percentage. Usually in all pulse oximeter, there's two numbers. One is the percentage of oxygen, a percentage. So we know 100% is perfect. But not everyone in this world is 100%. Maybe some of us have slight asthma, some of us has slight, maybe we are smokers, you know, it may not be 100%, but it's okay. It's nice to know what is your normal number. If your normal number is like, in my case, is 98%. So the first number on top is the percentage. Now it's 97, and the number below is my heart rate, 85. Okay? So the most important thing that the simplest thing you can do is just look at the percentage. Know what is your normal percentage. So if that's your normal percentage, you know what is normal for you. It's around 98, 99. When you wear it, don't take off so fast. Keep it a while. Keep it for like 2 to 3 minutes. Because it usually goes up slowly as it gathers more blood. So it goes up slowly. So keep it for 2 to 3 minutes. See what is your normal value. So if you have COVID-19 and you know you have COVID-19, and you know nowadays government don't actually pick you up early. They take a long time to come, few days later. So if you know you have COVID-19, check your oxygen saturation. Look at it and see what's the value. Monitor yourself. If it is going lower, below 95%, you need to go somewhere and inform some doctor. Don't sit at home anymore. You can see it as the disease progress. You can see the number keep coming down. Like the example I mentioned just now about my classmate's mother-in-law, who is 82 years old. She had 98 and 2 days later is 95. So you know something is not right. My advice for her at that time, if go down below 95, please send her to the emergency department. Send her to the emergency department. Just go. Don't wait for government to come and pick you. Okay? So that is what you need to monitor at home. You have to monitor 2 to 3 times every day. Nothing to do, just take up and measure lah. Okay? So, that's one thing you need to do. If you know you're COVID positive, please measure that. So don't wait until you're positive. Once you're positive, you have to be isolated. It's so hard to go and buy all these things. Buy it today. Sometimes you're not sure what is going on. You feel a bit tired. There are some people, they only feel tired. Excuse me. They don't feel, they don't have cough or fever or anything. They just feel tired. And sometimes just by feeling tired, you could be also already been in this hypoxic state, because we know in certain COVID patients, they have no symptom. That means they have no cough or flu or anything. But if they enter this second phase where they actually have this problem, where the lungs are attacked by these cytokines, they will actually feel tired because the saturation come down already. So sometimes, you know, when you feel a bit tired, a bit breathless, just take the saturation and monitor, because you know what's normal for you. So now when you monitor, you will know whether you're still normal or not. If it comes down, because you're tired, it comes down, please go and get a COVID test done. Please. Okay? So these are the things you need to do. You need to take care. So for those of you who joined this video late, go through the video again. Why people actually end up dead. It's quite scary, and especially many of those who actually come in dead are very young people. Of course, we like to say all COVID admit hospital straight, but we know government cannot cope. It's not they don't want, they cannot cope. We know a lot of hospitals now, they are given orders to surrender beds for COVID. We have no choice. We cannot cope. Government has actually tried their very best to get as many beds there are for all of you and all of us. But sometimes the number of beds that we can get is just not enough. So they need time before they come and pick you. But meanwhile, you have to monitor yourself, because they do not know that you are in bad shape. So once you know you're in bad shape, just go to the emergency department. Don't bother to go to CAC or anywhere else. Just go to the emergency department. With this pulse oximeter reading, with you, you go and you tell the doctor, I will not, before this it was what percent, now it's coming down. Something is not right, I think. Tell the doctor. Then the doctor will definitely do what is necessary to check you. So I hope this message goes through. Please share this message to all your friends and family. Please share it wide, because this is very important in this time when our COVID cases is at its peak. I hope this is the last peak we have, and I hope this peak is the highest peak it will ever reach. Today we saw the numbers come down a bit. I'm actually quite happy, and I hope it will continue to go down. So all of us need to play a role. Stay safe and stick to your SOP if you ever need to go out. I think the biggest problem with why COVID is spreading is all because people are not following SOPs. The common problem that is out there is, you see, work cluster. Why work cluster? You eat together, you drink together, so that is why it can cause a problem. So that's why COVID is spreading widely, especially when we visit our family members. Most of the COVID you get is either from your family members, because at home you don't wear masks, or when you go to work and you eat together, you drink together, when you take out your mask, please stay far away from everyone else. So that's the only thing I can advise. And of course, not to mention, please wear a proper mask. At least wear your mask properly. We still see a lot of people wearing masks below the nose, below the chin. Sometimes when I see that, I'm also speechless. I do not know what to say. It's been 1 year and people still don't learn. Okay, I have this question from Ng Si Pei. Dr. Tan, can we use the pulse oximeter for children too? It's supposed to be the same reading as adults. Yes, the reading should be the same. Whether children or adult, it should be the same. But children depends on how old and how small your finger. This standard size is for standard size. So of course your finger needs to be a bit bigger. So if you're saying like a big child, like primary school children, secondary school children, of course they can still fit their finger in. If you find that their fingers are too small, maybe you use the thumb, because it should be able also to fit the thumb, not just other fingers. So you can actually fit the thumb as well. Alright, so you can use the thumb as well for your children if they're small. If not, actually there are pulse oximeter for children, but it should be a little bit more expensive, because children pulse oximeter, usually it is a slightly different pulse oximeter. They will have another adapter that you plug on, and then you will use the other adapter, which is a smaller one, to fit a smaller finger, and that will be the ones for children. So if you want to find a pulse oximeter for children, you have to specifically look for it. There are pulse oximeter for children, especially for very young children. If you're talking about babies, 1 year old, 2 year old, less than 1 year old, they can't use this because their fingers are too tiny. And it's also very hard to tell a baby to put the thumb in and don't move at all, so it's also not easy. So it's better you get a very small ones to hold. But children, because they can't stop moving, it can be a bit challenging. So if you are talking about like you want to monitor your baby, then one thing I can advise you is you get the small one and you check it when they are sleeping. Because when they're sleeping, they are not moving their hands at all, and then it will be more accurate. So you put it in their finger when they're sleeping. So for very small children, you may need to get a pulse oximeter that is meant for small children. There are two types out there. One is exactly the same as this, but it is smaller. So smaller, then it is like so tiny, and then you can just hold it onto their fingers. That will be one way. The other type is the wrap around one. So it is a long, like a plaster like thing, a cloth like thing, where you just put over the finger and then you wrap around. But I think that one is slightly more difficult to use. But if you use that, you need to understand a few things lah. Because if you look into the pulse oximeter, if you look inside, there's actually two things. One spot with a light and one spot which is a reader. There's usually two black dots. This dot has a light usually a red color light, and there's another spot which is the part that is reading it, the monitor itself, the thing that's reading the oxygen saturation. So if you're going to wrap around the finger, you have to make sure the one part is the light and the other part is the monitor. It has to meet each other, both of them, because the light has to hit the part that is detecting the light, so you can you can actually make sure you wear it properly. But if you get the ones that you clip on one, then of course no problem, it will be very simple. Okay, some of you ask whether you can for Huifeng asks, for child 1 year old cause finger can't fix, can use foot toe to check or not? Can, but we normally say that foot is it's definitely possible, but again the size must fit properly. Sometimes it's not so ideal as well to actually put in one toe inside here and leave the other toes outside. It may not fit so well. So when it doesn't fit so well, because you see when we fit, it actually fits well, it goes around the whole finger, so then the reading may not be so accurate. But so it's always better for children to get the children pulse oximeter. It will be more accurate, because when it's not accurate, even though we know that, okay, if I put on my child, if you are using a toe, is not accurate, I don't think you can get 97, 98. Maybe you will get 92, 93, but you take that as my child normally is 92, 93. So if now go down to 80 something, of course I need to worry. But sometimes I only worry that because it's not accurate, because it cannot be placed properly. Even if the reading is low, it may not be really your baby got problem. So it's better to get a pulse oximeter that can fit a child. Okay, yes. And yeah, if you want to know, actually we do have pulse oximeter that can fit children. If you want, you can always order it from my staff or from my clinic. We can always order it for you, because in our clinic we have the pulse oximeter that meant for children one. So if you want to order, you can directly contact my staff also. Okay, all right. So I think yeah, any more questions? If you have if not, I hope that this video you will share with your friends and family, because everyone need to know how to monitor the pulse oximeter at home because of these incidences of happy hypoxias. So this is very true with this COVID, because even in hospital we notice there are patients that we think they are getting better, and then 2 days later they just gone back again and then went back to ICU. So this is a problem with COVID. Patients can be better today and get worse 2 days later and die the next day. So it is actually quite worrying. So we need to monitor this thing for everyone who has COVID positive. So the two important things you need to know in this particular talk is, number one, if you are not feeling well, whatever reason you're not feeling well, don't say that maybe it's okay. No, get a COVID test done, because if you are positive, then you will have to monitor yourself with the pulse oximeter. You need to make sure these two things, okay? Because I know a lot of people who are having mild cough, mild flu, they are not testing. That is no. Now there are just too many COVID out there. Please do a test. If you're not feeling well, you do a test. That's the only way to keep yourself alive, and also to prevent the spread of the virus to everyone around you. And once you know you're positive, please have a pulse oximeter and monitor it every day until the hospital until government pick you up. Okay, until government pick you up, please monitor it, because at home, if you're not monitored, you may think you're okay, but actually you may not be okay. All right. Natasha has one last question. Is hi Dr. Tan, may I know, is KN94 mask reliable or safe to wear? Yes, because I've been explaining to all of you to get better masks. Of course, if you were to do double masking, which is what explained by DG, you wear a 3-ply mask inside followed by another cloth mask. It also protects you better, but maybe only around 80%, 80+%. If you want, you see what is the number 94? 94 means it protects you 94%. So it's definitely better than double mask. But there is also a criteria, you know, you must make sure that it's well fitted. I noticed some of you, when you wear KN95, because KN95, sometimes for certain people, whether with the face is too small or the nose is too flat, actually this part is not well fitted. So if it's not well fitted, it's not well protected. Then in that case, I would think that KF94 will be better because it will be more well fitted. Because 94, 95 is only 1% difference, so it's not too much different. More important, it must be very well fitted. Then if it's very well fitted, means it's totally covered. You can feel it's totally covered, there's no hole at all. Then of course it is well protected, okay? You can buy a good mask, but if it doesn't fit your face, it actually doesn't protect you either. So you need to buy a good mask that at the same time has to be well fitted. Janice Wong asks, if a person has heart problem history, the percentage of pulse oximeter, is it lower? It can. That's why I say it's always good to buy one first, and then look at what's your reading first, so you know what is your normal reading. Because if you have some heart problem, some asthma, or you are a chronic smoker, or you have lung cancer before, or you have TB infection in the past, so you won't have such nice reading one. So when you don't have such nice reading, but that is normal for you, so maybe what's normal for you is not that high, but that's normal for you. So when you are sick, you want to look at it and see whether it's still the same. But no matter how, everyone will still be more than 90% lah. Because if you're not more than 90%, then I don't think you will be nicely walking around if you have heart problem or whatever. So most of us will still be more than 90% in our normal state, no matter what kind of illness we have. So first you need to buy to know what is your oxygen saturation percentage in your normal self. Then when you have COVID, then only you know how to monitor. So that is how it goes, okay? Alright, so I guess that's all the questions you have today. So I would like to end my session, and thank you once again for joining me in my weekly Sunday 9 PM live video. So for all those of you who have missed the previous videos, please go and look at my YouTube channel. And also for those of you who have missed anything, remember, and if you go to the YouTube channel, do remember to subscribe and turn on the notification button, yeah? And yeah, there's one last question coming in. Tan Sheyan asks, Doctor, is it safe to go jogging outside? Of course it's safe to go jogging outside, but please bring your mask together with you. Okay, as long as you're jogging alone, if you're not wearing mask and if you're alone, there's no problem at all. Number one, we know outdoor is safer than indoor, so it's relatively safe being outdoor. But if you're going to be close to someone, then you can still get infected. Because when you exercise, you don't just jog. You have to drink water, you have to rest. So it's those times where you rest and drink water. No, where are you resting? Are you alone? If you're all totally alone, far away from other people, you don't get near anybody, there's no issue at all. But if you are going to be near someone, that is when we worry. So if you're jogging all alone, it is very safe. But if you're not jogging all alone, or you're jogging in a place there's a lot of people, then my advice for you is still to wear a mask when you jog. Many of you may think that wearing a mask can jog, meh? Trust me, if you have been practicing doing that, you can. Why? Is because my kids, they are actually athletes. And they are also going for, my kids will be going for SEA Games. So when you go for SEA Games, you know you cannot stop your training. And they wear masks during training. Because I told them, if you don't wear, then don't train. And at the same time, their coach is very good. She also insists that everybody must wear masks. And for the last 1 year, they've been training with a mask. Because even with a mask, I tell you, you can still breathe, oxygen can still enter, you don't have to worry. We also know that in hospital. Because in hospital, sometimes when we give you oxygen gas, we even give you over the mask. Even by putting a mask, the oxygen over your mask, we can still maintain your saturation, oxygen saturation at a very good level. That's why we know there's no problem one. You don't have to take off your mask to get oxygen to exercise. But it needs a bit of getting used to. Initially, it's difficult, but over time, you will get used to. So if you're going to jog outside, and jogging is something that you really, really want to do, and it's good. Jogging is good. Exercise is good. Start practicing to wear masks. Start off wearing masks, see how far you can run. When you cannot stand, you take off. At least you slowly practice. That's how they got used to it earlier on. They wear for a certain distance. After some time, they cannot take it, they take off. Then slowly, you will realize there's no big deal one. Jogging and mask, no problem. It's just that sometimes you are filled up with sweat inside. You may need to wipe and then wear back. There's no problem. It's about getting used to it. My children wear masks during sport training. There's no problem at all. Those days they wear 3-ply masks. Now they are wearing KF94 during sports training. So there's actually no problem wearing masks during training. So I strongly advise all of you to wear masks during training. You do see certain videos on and off on internet. People who are doing a performance totally with masks. Ice skating performance in masks. A dance performance with masks. It's equally strenuous. They can do it with a mask. It's a matter of getting used to. So if you are going to jog totally alone in places where nobody comes near you, mask or no mask, no problem. You stay far away from people. But always have a mask with you so that just in case sometimes you need to stop or you need to go somewhere where you see people, then please put your mask back on. But if you're going to go to a park to jog or somewhere where you know a lot of people go there jogging, my advice for you is still to wear a mask. Especially now where the number of cases is very high. We have to wait and see. When your number of cases have come down or most people are already vaccinated, maybe mask or not is not important anymore. Like in US, they allow people to go jogging without masks because their people are mostly vaccinated. And the number of cases have already come down. But for us now, at the peak of the pandemic, if you're going out jogging, if there are other people, please wear a mask. Okay. And yeah, one more question is from Tan Yok Kwen. He's asking if I got endometrial polyp, can I go for AZ vaccine? As I always say in my last few topics, you don't need to ask this question. You go to your vaccine center. When you reach your vaccine center, there will be a form for you to fill. In that form, every situation whereby you are not allowed to have the vaccine will be there. If you see your condition there, please tick. And when you tick it, you will be brought to see a doctor. And when you see the doctor, you explain what problem you have, and that doctor will decide for you whether you are suitable for the vaccine or not. So this is the simplest advice I give to everyone. So you do not need to go around asking doctors whether I can do, cannot do. Because there are just tons and millions of, I'm not the only doctor. I tell you, there was a time where my Facebook Messenger just had notification, the ring notification tone rings every 5 minutes. It's not just me, it's like almost every doctor in Malaysia had that over that period of time when AstraZeneca was about to open for vaccination, and also shortly after the AstraZeneca vaccination day was over. Because many of you got it and then start questioning, don't know can or cannot. So the answer is very simple for everyone. This is a standard answer for everyone. When you're called for your vaccine, go there. Go there, there will be a form. Look whether your condition is there or not. If yes, please tick it, and they will bring you to see the doctor. Inform the doctor what's your problem, and the doctor will tell you whether you can be vaccinated or not. Okay, you don't need to keep asking us because the number of conditions is really a lot, and many of us are also very exhausted trying to answer the same question again, because it is almost the same answer for every question is yes, can. Because almost everything in this world you can vaccinate. There is no reason why you cannot vaccinate. So go for your vaccination. Alright? Okay, that's all for now. I guess I should end this now. So see you all again next week, same day, same time. Bye bye.